Hello everyone, welcome to your lecture on nutrition and nutritional imbalances. The objectives we will be covering are the following. What is nutrition? Nutrition is the intake of food and how food nourishes the body. Nutrients and how they are handled by the body, and the impact of human behavior and environment related to food choices. So this involves metabolism and absorption. Please read over this. We've covered metabolism before, but basically it's two types. You have anabolism and catabolism. Anabolism is building a more complex biochemicals, is the promoting growth. Catabolism is the breaking down of process. And absorption is the small intestine. The primary site of absorption is done through passive diffusion, osmosis, active transport, and pinocytosis. What are nutrients? They're specific biochemical substances used by the body for growth, development, activity, reproduction, lactation, health maintenance, and recovery from illness or injury. You have essential and non-essential. Essential nutrients are not synthesized in the body or made in sufficient amounts. They should be provided in the diet or through supplements. For example, these are macronutrients like carbohydrates, proteins, and lipids. Then you have micronutrients, which are vitamins, minerals, and water. Non-essential nutrients do not have to be supplied through dietary sources because they're not required or synthesized by the body in adequate amounts. Energy nutrients. One of the three energy nutrients are your carbohydrates, your protein, and your fats. Carbohydrates are the primary source of energy and sugars, and they supply energy by converting the glucose for transport through the blood, the efficient fuel that certain tissues rely on most exclusively for energy. For example, the central nervous system depends completely on sugars, on glucose. The liver stores glucose, and we're going to cover this a little bit more when we talk about diabetes next. And it regulates entry into the blood. Cells oxidize glucose to provide energy, carbon dioxide, and water. You have simple and you have complex carbohydrates. Simple carbohydrates are like simple sugars that occur in these following different types of sugars: honey, milk, table sugar, molasses, etc. Then you have complex carbohydrates that are found in vegetables, breads, cereals, pasta, grains, legumes, crackers, all those things. Dietary recommended intake is 45 to 60% for a regular healthy adult. Energy nutrients also include proteins. Proteins are a vital component of the living cells. They're required for the formation of all body structures, right? They're used for tissue building, metabolism, immune system function, acid-base balance, and they also serve as a secondary energy source. The first source is carbohydrates, second is protein. So there are different types. You have complete proteins and you have incomplete proteins. And below are please read over the recommended dietary intake. So proteins and nitrogen balance. What is this? The thing is that when your anabolism, like the amount you take in, the foods you eat, equals your catabolism, what you're breaking down, then your nitrogen balance is neutral, which is a balanced, healthy adult. Now, if your catabolism, you're burning down more than you're eating, then that creates a negative nitrogen balance in your body, which, for example, leads to tissue wasting. That happens during starvation, illness, stress, right? And when you're eating more than you break down, right? So you're eating a lot more, but you're not burning it, then it creates a positive nitrogen balance. That's tissue growth, right? And this happens in childhood, pregnancy, lactation. And energy nutrients are also include, lipids. Lipids are composed of carbon, hydrogen, and oxygen. They're insoluble in water and blood. Their function is a backup energy source. They provide organ insulation and protection, aid in absorption of fat-soluble vitamins, flavor and satiety, and they help to digest fats. You have different types. You have saturated, which raise cholesterol levels. Then you have unsaturated, fats that help lower cholesterol levels, and these are most vegetable oils, olive oils, nuts and avocados. These are the dietary recommended intakes, as you can see down here. Now, one thing to remember though is we want to encourage a low-fat diet, and especially in saturated. We don't want people to eat too much saturated fat when they're at risk for heart disease. Okay, now for vitamin regulatory nutrients. These are what your minerals, your vitamins, minerals, water. So vitamins, they're organic compounds. They're needed by the body in small amounts. They don't provide calories, right? So they function as metabolism of carbs, protein, and fat, and prevent deficiency disease. They prevent chronic illness. And the different types. You have fat-soluble vitamins, A, D, E, and K. They're stored in the body. We don't need them every day. They're not readily excreted. So if you take too much of it, it can lead to toxicity. Then you have water-soluble vitamins. For example, vitamin C and B complex. We excrete them in excessive amounts, and they're not stored in the body, so we do need to consume these daily. Fresh fruits are always higher in vitamins than processed foods. They're absorbed through the intestinal wall directly into the bloodstream. Minerals are another regulatory nutrient. They're organic elements found in all body fluids and tissues. Their function is fluid regulation, nerve impulse transmission, energy production, bone and blood health. They also help rid the body of byproducts of metabolism, and they're also, good for disease prevention. As we covered last week in fluid and electrolytes, you can see the important role that they play in the body, right? For example, calcium's relation to osteoporosis, right? Iron and anemia, magnesium with hypertension and coronary artery disease. Now, sodium has a relation with hypertension, myocardial infarction, and stroke. You want to maintain those sodium levels, not eat too much sodium. So there are different types. There are micro minerals, calcium, phosphorus, sulfur, sodium, chloride, potassium, magnesium. Then you have micro minerals. Those are iron, zinc, manganese, chromium, copper, and the fluoride and iodine. Water is also a regulatory nutrient. We've talked about, when we talked about fluid balance, how important water is, right? Your body is made up of 2/3 of water. It's an extremely important component, right? Made of hydrogen and oxygen, accounts for between 50 to 60% of the adult's total weight. What does it help in? It helps in body structure and form, temperature. It acts as a lubricant. Excuse me. It provides fluid medium necessary for all chemical reactions in the body. It acts as a solvent. It helps with digestion, absorption, circulation, and excretion. Right? There are different types, and we talked about this in our fluid and electrolyte lecture as well. We have the intracellular and the extracellular fluids. Balancing this energy. It's important for us to understand energy balance, right? Energy is derived and obtained from foods that we eat. They're measured in kilocalories, often called calories. Only carbs, protein, and fat provide calories. Remember, we said your vitamins, minerals, and waters don't provide calories. A kilocalorie raises the temperature of 1 kg of water by 1 degree centigrade. So stable weight is kilocalories consumed equal to kilocalories burned. So the amount you eat and you burn that amount, then that's maintain a stable weight. Too few calories, then it causes you to become undernourished. Too much kilocalories can lead to obesity, increased risk for chronic disease. So carbohydrates provide approximately 4 kilocalories per gram. Protein provides about 4 kilocalories per gram as well. And then fats provide 9 kilocalories per gram. You can see how much, that's why fatty foods have so much calories in them. So now to calculate kilocalories and our requirements, for example, let's look at this. The patient eats an ice cream with 20 grams of carbohydrates, 10 grams of fat, and 5 grams of protein. How many calories is that? So how would you find that answer? You're going to take the 20 grams of carbohydrates, look at how many kilocalories do carbohydrates provide. That's 4, right? 4 times 20. How much would that be? That's 80 kilocalories. Then you look at 10 grams of fat. And if you look at fat, provides 9 kilocalories per gram. So 9 times 10, that's 90 grams, right? Then you have 5 grams of protein. Protein provides 4 kilocalories. So you multiply that by 5, that's 20. That's how you can calculate the kilocalories, that a patient gets with the food they ate. So basic metabolic rate, what is that? That's the amount of energy required at rest. So that's when you're resting. So imagine if you're exercising, would you need more or would you need less? Right? So when you have physical activity, when you include physical activity, exercise, all these things, now your demand is increased. You need more, your basic metabolic rate is increased. So your total energy needs are replacing calories used for the BMR, your basic metabolic rate, that's the amount of energy required at rest, plus physical activity. That's your total energy needs. Males have a higher BMR due to larger muscle mass. Factors that increase BMR are growth, infections, fever, emotional tension like stress, extreme environmental temperatures, elevated levels of certain hormones. Factors that decrease your basic metabolic rate are aging, prolonged fasting, and sleep. So now you have a decreased requirement for energy. So what are our total needs? Females need about 0.9 kilocalories per kg of body weight per hour. Males require 1 kilocalories per kg body weight per hour. For example, if the patient weighs 245 pounds, you're going to convert that to kilograms first. And then, for example, if it is a male, you're going to convert that to kilograms, multiply it by 1, then you will know how much total energy a person requires, how many kilocalories, a person requires per day. And that's how we can help patients, kind of realize how much they need to eat per day, depending on their weight. Okay, body mass index. That's your BMI, the ratio of weight in kilograms and height in meters squared. It provides an estimate of body fat, can be used as an initial assessment of nutritional status. It's calculated with a mathematical formula, but we have a lot of scales out there and charts that you can just use to calculate the BMI, right? Overweight and obesity are defined differently for children, though, and teens. So now if you look over here at this chart, this gives you the basic underweight is 18.5. Normal is 18.5 to 24.9. This is extremely important for you to remember what the normal is, right? Overweight is, all the way up to 29.9. And obesity is anything 30 and higher. And that's also very important for you to remember. It's important for you to remember the normal, and below 18.5 is underweight, and obesity is 30 and greater. So where can we find this information of, like our dietary reference intakes, recommended dietary allowance, RDA, the average daily dietary intake, a nutrient that is sufficient to meet our nutritional requirements. We find this on food labels. So you're going to start here with the serving size right here. Then you check to see, okay, how many calories this gives us. Then you limit these nutrients right here, the trans fat. You want to limit the fats over here, right? Then get enough of these nutrients. And then these are the recommended values right here. It shows you here. We can also use, teach patients about our My Plate food guide. If you notice over here, your food is, divided into certain amounts, and this is how your plate should look. Your vegetables are the largest amount. You have some fruits, you have some protein, and you have some grains, right? So this is how, your plate should look. Then you have food labeling. That's also another way to find the information about how much recommended intake, our dietary allowances, So let's talk about nutritional imbalances, right? Nutritional imbalances can be either too much or too little. When it's too much, then you have overweight or obesity, right? You're consuming nutrients in excess of metabolic demands. Remember, we talked about basic metabolic rate, or our, basic, our energy needs for the day, right? So if you're consuming more than that, then it can lead to obesity or being overweight. So more than needed for activity, gender, height, weight. That's a BMI of greater than 24.9 leads to, is overweight, right? Greater than 30 or greater is obesity. What are the causes for obesity and being overweight? Genetic, dietary intake, sedentary lifestyle, medications, learned behaviors, and emotional eating. So what are the consequences of nutritional imbalances when you have too much? That's overweight and obesity. That can lead to diabetes, heart disease, hyperlipidemia, hypertension, sleeping problems, breathing problems like increased asthma and shortness of breath. It can cause mobility issues like joint pain and exertion, skin problems like heat rash, fungal infections, acne. It can even cause cancer like stomach, liver, gallbladder, pancreas, ovary, thyroid, brain, blood. It can reduce self-esteem. It can cause loneliness and social isolation, and it can also lead to depression, anxiety, obsessive compulsive disorder, for example, like binge eating. Then we have nutritional imbalances when you have too little nutrition. What is that? That's underweight and undernutrition. That's insufficient intake of protein, fat, vitamins, and minerals. That's when you're consuming less calories than needed according to your activity, gender, height, and weight. That's a BMI of less than 18.5. What can cause this? Difficulty of chewing and swallowing. So if you have patients who cannot chew and swallow, we need to make sure that they're getting the nutrition they need so they don't suffer from being, malnourished. Then you have alcoholism causes undernutrition. Metabolic disorders, chronic diseases can alter nutrient intake, digestion, absorption, excretion, right? Situations that can increase metabolic demand are illness, especially high fever increases the need for protein, water, and calories. Traumatic injury, example, burns and surgery, they require extra protein and vitamin C for wound healing and tissue rebuilding. So a person can also be malnourished with regard to specific nutrients without being underweight. So it doesn't mean that you're going to be only suffer malnourishment if you're underweight. You can be, a normal weight or overweight and still be malnourished because you're not getting the specific nutrients your body needs. Now, what do nutritional imbalances do to us, right? Please read over this chart. This kind of gives us an idea of what we see in people who have, imbalanced nutrition. For example, general appearance. They're going to be easily fatigued. They're not going to have energy. They fall asleep easily. They look tired all the time. They're, apathetic or cachectic. What is cachectic? Cachexia is muscle wasting, right? So when you have atrophy of the muscle, you lose your muscle. Then weight, they're going to either be overweight or obese. Posture, they're going to have poor posture, sagging shoulders, sunken chest, humpbacked. Muscles are going to be flaccid, weak, poor tone, tender, wasted appearance, impaired mobility, mental status, inattentive, irritable, confused, right? Then you're going to have, neurological function can also be affected by imbalanced nutrition. You could have burning, tingling of hands and feet, loss of position and vibratory sense, decrease and loss of ankle and knee reflexes. So please read over these, each of these body functions and systems, and see how imbalanced nutrition can affect these. What are the factors affecting nutrition? We have physiological factors such as stages of development, your age, state of health, medication, social determinants of health. We talked about those. Those also affect nutrition. You have culture, the kind of food that culturally you're used to eating, right? Learned aversions to food, right? Sex assigned at birth, state of health, alcohol use disorder, medications, mega doses of nutrient supplements. All of these can affect nutrition. Who are the patients at risk that we need to be very careful with? Because nutrition is a very important component of, being healthy. We have to be extremely vigilant about patients who are NPO, nothing by mouth, right? They are on clear liquid diets for greater than 3 days because they might not be getting the nutrition they need, right? So to meet their total energy needs for the day. Older adults, they're also patients who are at risk. Patients with digestive issue, patients who have impaired chewing, swallowing, difficulty feeding self, or they have dry mouth. Because when you have dry mouth, they're not going to really eat, right? Because it's bothersome for them. So we need to be careful with these patients as well. And those patients that have nausea and vomiting for more than 3 days, so they're losing a lot of, minerals and stuff, right? We talked about this in fluid and electrolytes. So people who have GERD, esophageal reflux disorder. Then we have decreased gastric secretions, patients with glucose intolerance, constipation, patients who live in underdeveloped nations, especially children and older adults and children and older adults as well are at risk, because they might not be getting their total energy needs for the day. People with chronic illnesses. Serum albumin is a golden standard to measure a person's nourishment. Anything less than 3.5 is concerning. So serum albumin level of less than 3.5, please remember that number. It's extremely important for you to remember that, signifies a lack of nourishment. Increased nutritional requirements. People, for example, who are these people who require increased nutrition? Those are people with wounds or burns because they need that for wound healing. At a planned loss of 10% or more of a patient's usual weight, this patient is also at risk. If there was unplanned loss, not planned weight loss, if they weren't planning it and they lost 10% or more of their usual weight. Patients at risk also include patients with eating disorders. For example, anorexia nervosa. It's a psychiatric disorder characterized by self-starvation. These people starve themselves, And then you have bulimia nervosa, where people binge eat and they induce vomiting after they eat, or they, use laxative to purge the food. It's more common in women and onset usually before the age of 20. So let's focus on the older adult. We have in older adults, what affects their nutrition? They have gastrointestinal changes, right? That affect digestion of food, maintenance of nutrition, changes in teeth and gums. They might have dentures, they might not have teeth. Reduced saliva production. Atrophy means losing muscle wasting of the oral mucosa. Epithelial cells, right? Increased taste threshold, right? They might not taste food as they usually do, right? Or, and then may have decreased thirst sensation, reduced gag reflex that can cause them to aspirate, and decrease esophageal and colonic peristalsis. So they get full faster, right? And so they don't eat. Chronic illness can also exist mostly in older adults, and that can affect nutrition. And inadequate nutrition, it can be just their lifelong eating habits, culture, socialization, income. Remember, we talked about social determinants of health, right? And then you have physical function level to meet activities of daily living, loss, dentition, their teeth, and transportation. They might not have transportation to get to the store to buy food, right? What are some nutrition can also be caused by adverse nutritional imbalances can also be caused in older adults because of the adverse effects of medications that they take. It can cause anorexia, GI bleeds, xerostomia, right? Early satiety, impaired smell and taste perception, right? Cognitive impairments like delirium, dementia, depression can also affect nutrition in older adults because it affects the ability to obtain, prepare, and eat healthy foods. Dysphagia and aspiration. Dysphagia is what? Difficulty swallowing. Now, these patients are at risk for nutritional imbalances, right? Not getting enough nutrition. Now, it can be caused by myogenic causes, for example, like, myasthenia gravis, aging, muscular dystrophy, polymyositis, right? All of these are muscular problems that they have, and that's the reason why they can't swallow. Or it can be neurogenic, maybe related to a stroke, cerebral palsy, Guillain-Barré syndrome, multiple sclerosis, ALS, Lou Gehrig's disease, diabetic neuropathy, Parkinson's disease. All of these can cause, affect their nutrition because of neurogenic reasons. Obstructive, they can have obstructive dysphagia. For example, the benign peptic stricture or lower esophageal ring. So it's basically it's the esophagus is obstructed. It could be caused by candidiasis, head and neck cancer, inflammatory masses, trauma, surgical resection, anterior, mediastinal masses, any masses in the cervix, in the esophageal area, cervical spondylosis. So what can happen what are the complications of dysphagia and aspiration? Right? You have aspiration pneumonia. They aspirate and the fluid goes into their lungs and causes aspiration pneumonia. Dehydration, decreased nutritional status, weight loss, disability or decreased functional status. You have increased length of hospital stays because they can't get the nutrition that they need, right? Increased healthcare costs for them, increased likelihood of discharge to institutionalized care, and increased mortality. For example, if a patient is not able to has difficulty swallowing, they're more than likely there's a chance that they're going to get discharged to a facility like a skilled nursing facility or a rehab so they can, um, learn to, fill their nutritional needs. Okay. Then you also have religious diet restrictions. Example, in Islam, you have no pork or alcohol. In Ramadan, patients are fasting for a month, right? You have ritualized methods of animal slaughter. They can only eat halal food. So if you have a Muslim patient, and they don't want to eat, you need to find out from patients, okay, what can I do to help you, that maybe they don't eat, the meat there. So maybe they can have alternatives like vegetarian alternatives. And in Christianity, for example, some faiths, such as Baptists, allow minimal or no alcohol consumptions, right? There are some meatless days. We need to be vigilant of those. We could ask them, for example, commonly during Lent. Seventh-day Adventists, they don't eat pork or shellfish, alcohol, caffeine, vegetarian, they're vegetarians. And so we need to find out what the patient, how the patient eats, what they eat, so we can help them maintain their nutritional status. Judaism, they also follow the no pork, predatory fowl. They have, quite a few restrictions. Then you have no mixing milk and dairy. So it's good to find out from the patient or, look up, okay, these are the things that they eat or they don't eat, that they prefer, and then verify those preferences with the patient. And obviously the best historian is the patient. For example, you also have Hinduism, Hindus, Buddhists, they don't eat meat, fish, shellfish. Okay, and they have restrictions with alcohol as well. So providing nutritional support. How do we provide nutritional support? We can provide this through special diets. For example, therapeutic diets, consistent carb diets, fat or sodium restricted for people with heart disease, high or low fiber diets, right? Renal diets, people who have renal, failure, they have different kinds of diets. People who have diabetes, they have low carb diets, they have to count their carbs. Then you have modified consistency diets. These are for people who can't chew or swallow, they have difficulty with those things. So you could provide, dietitian will see them and they will provide maybe a clear liquid diet. Maybe they have a procedure coming up, so they're on a clear liquid diet, or a pureed diet, or mechanically altered, like they might be smooth consistency, blended foods, right? Some patients may have special needs. For example, they're nothing by mouth. They have nausea, they have impaired swallowing, impaired digestion. So it's extremely important to, provide that nutritional support for patients requiring these special diets. Other forms of nutritional support is short-term is a nasogastric tube. We call it the NG tube, right? Or the duo tube that goes through their nose and, to the stomach or the duodenum. Then we have long-term special, long-term nutritional support, and that is through your percutaneous endoscopic gastrostomy. That's your PEG tube. If you see a picture right here, it literally is a tube that goes straight through the wall of the abdomen and directly into the stomach. It's the preferred route for delivery of enteral nutrition in patients who are comatose, right? Placement of tube in the stomach can be accomplished. It's done by a surgeon. It can be, it's surgically done. And please look at the clinical judgment measurement model for nutrition that I've uploaded in Canvas, and we will review that in class together, but please review it before class. And that is it for your lecture on nutrition. Next will be your lecture on glucose regulation, diabetes, and then diabetic ulcers. I will see you in class.